welcome back to the Love is Healing podcast. I'm your host, Magnolia Heaton. I'm a licensed clinical social worker, a certified sex addiction therapist, certified multiple addiction therapist. I specialize in treating eating disorders, complex trauma, sex addiction, other addictions, betrayal trauma, and a bunch of other things. But like my niche, the easiest, the second, my second nature is complex trauma. Anyhow, just talk about a bunch of different topics here, talk about different stories, whether it's myself or interviewing other people. And the intention is to help connect and then also help increase awareness of yourself and of others, and in so doing, helping you to connect with other people better and having that trickle effect of love healing the world. Thank you for joining us today. If you're here for our last podcast episode, I apologize that the audio was not the greatest on my guest's behalf. That's the first guest that I have on this podcast, so I now know that I should have guests speak up louder, and I will. So yeah, today I want to talk a little bit about therapy. I tried recording another episode just now, actually. It's so tricky to record podcasts. Like, I think it's different from recording videos because as I'm working on these, I'm channeling as if you're going to be listening to me rather than seeing me. Though I am going to upload the videos on YouTube, but it's like primarily listening, right? So it's just a different modality and a different skill set, I think. And I'm trying to like really focus on my voice rather than the picture. It's different. Anyhow, I am obviously a proponent of psychotherapy, and I think it's wonderful and I think it's helpful. And at the same time, not all therapies are created equal. There are different modalities, right? So I think let's just talk a little bit about the biopsychosocial spiritual aspect of things. Because again, those are four prongs of social work those are four prongs that in social work we use to conceptualize things, conceptualize cases, and conceptualize overall health. So then, on the biological end of therapies, we have things like working with the body. So what is now called somatic therapy or somatic psychotherapy. And that could be a broad range of things. So we have things like brain spotting, EMDR, and kind of polyvagal theory, and breath work and mindfulness and different things like that. I could argue that DBT could fall under that if you have a therapist, facilitator, practitioner who really knows how to work that in. But yeah, that's becoming increasingly popular, I think, especially as people are starting to become aware that when you treat trauma, it is in fact ideal to treat it from the bottom up, which means that the bottom part of your brain is what's responsible for survival, for breathing, for eating, for digesting, for sleeping, and things like that. And that's where a lot of the trauma memories are stored. And a lot of pre-verbal memories or non-verbal memories are stored. And we work on rewiring that to help release it from the body. Because there's a lot of trauma that you can't really talk about, or you can talk about it, or you can access it cognitively, but there's still that disconnect between whatever your thoughts are versus what your brain, versus what your emotions are experiencing or how they translate the trauma. So that's a little bit about biological side of things. And also I would argue that polyvagal theory falls under that because it really helps to give a trauma-informed lens on things in that way. And it helps, for me anyway, in the way that I use it and teach it, is that it helps to read the body. So if you're shopping for a therapist, and this isn't medical advice, but I'm saying like the way that I would tell someone, it'd be like, yeah, shop around and see for someone who's trauma-informed and someone who can work with the body or knows how to ask the right questions and things like that. and who knows about polyvagal theory. And on our Love is Healing channel on YouTube, Love is Healing LLC, we do have a few videos on polyvagal theory, which I think are pretty great, that have been made by some of our lovely interns that we've had. And then there's the psychological aspect, which just kind of means like, obviously your psyche, but it could also be on an extreme end, like, yeah, it's just about you and you as the individual and how you change, and if you change, other people change, which is true. I do think that it is more complex than that, though. And I'll say what that, like, some modalities that typically fall into that are like solution-focused therapy or cognitive behavioral therapy, even DBT or dialectical behavior therapy. I think those are the main ones. But anything that's pretty cognitive or behavioral, which means, well, just think this and you'll be fine, or just address this, change this behavior and you'll be fine, which can work at times. I do think it is more complex, especially because we all have complex trauma and we're just human and we're dynamic. Then we have the sociological aspect of things, or social aspect of things. And that's where I think we work more with the system. So we think more person and environment. We think attachment theory. I think those are the major ones. You could also argue that DBT falls under there, because DBT has a facet of it where it talks about being able to relate with other people, problem solve, communicate, articulate, assert oneself, different things like that. And I apologize if I'm omitting some. I'm not. I don't practice other things. Like, I have practiced ACT therapy, acceptance and commitment therapy, but like not a ton. And then the spiritual component, I mean, that could entail a lot of different things. Of course, Christian therapy. And then I think really what it means, I think it's more of a paradigm than anything, which to me means we have the client, we have the door open, and we hold space for whatever their spirituality is, right? And I would like to say that spirituality is on a continuum, several. But the one that I really want to highlight is that there are more rigid forms of spirituality and more fluid forms of spirituality. So the more rigid ones are the ones that I've historically seen cause more harm and trauma to people, whereas the more fluid ones tend to be maybe a reconstruction of one's own spiritual path, we'll say. But yeah, holding space. And to me, I was talking about it today with someone about how spirituality can mean lots of different things to different people. And to me, personally and professionally, it means connection. So whatever your sense of connection is your connection. Sorry, it's a sense. I'm so sleepy. Forgive me. You're getting to see my humanness or my humanity. But anyhow, connection in that there's something greater than just ourselves. That's not my own definition, but I heard it somewhere in one of my addiction trainings and I really liked it. It's something greater than ourselves. I think I also was listening to some kind of 12-step thing, and they were saying that, like, sometimes in the rooms they'll be like, all right, cool, well, you don't want to believe in God, or you don't believe in God, that's fine. Believe in everybody here in this room with you. Because even the group has power, right? And wisdom, and that is the greater good. And so, like, it does have more power than the individual itself. Anyhow, I want to say that because I know that there are a lot of people, present company included, that have had a lot of spiritual trauma. And I want to be able to hold space for that, because it is such an important facet of things that sometimes we do have to be creative because of the traumas that we've had in the ways in which we define the word spiritual. But I think it's important to look at these 4 facets and look at what your values are. That way, when you're out there looking, and to me, it is a lot like dating. I think there's a period of time where I was dating and looking for a therapist, and it really, really felt really similarly. Like, do I like this bio? Do I like this photo? Do I like this energy? That kind of thing. What are their qualifications? I don't know. Lots of factors to consider, right? But me personally, I want someone who does have the skill sets I'm seeking, who is equipped and competent to work in the issues I'm wanting to address. And then the connection is really important too. Because if you don't have the connection, it is awkward. And then I think you can't be fully yourself. And if you're someone who's highly sensitive and or empathic, I think that can make things even trickier. Or if you consider yourself to have psychic abilities or anything like that. Because then you can be really sensitive to other people's traumas or something like that. And that adds another layer, right? But I think within reason, just notice what your non-negotiables are. And what things have some wiggle room. So that you can make choices from there. I hope that helps. Then I was thinking about my personal experiences with therapy. And in my practice, I train people regularly. Whether that's like individually or in a group setting and things like that. I train on a bunch of different topics. Honestly, just whatever presents in the moment. And when I do that, especially when I'm training new clinicians, whether they're interns or therapists, I really like to talk about, right, how I said earlier that not all therapists are created equal. Also, I mean, I've had some pretty rough therapists, right? And that's been hard on me and my healing. But it's also been a gift because I do believe that pretty much every adversity has the potential to hold a gift for us. And the gifts that they left me are that they really taught me what not to do, which I think is super important and imperative, especially as a teacher of therapists. Yeah. So, like, well, actually, I had a first therapist, and that was in college, in undergrad. And I tried, right? I was like, I'm a psych major, whatever, blah, blah, blah. These people are supposed to, we didn't have these words, but basically be a safe space and like a trustworthy person and stuff or whatever. I was like, I'll try it, right? Because I was extremely desperate for help. I had complex PTSD and came from a really enmeshed family and thought, all right, bro, like I'm desperate, let's go. And I did, but it wasn't what I expected. And I was just asked very sterile questions, and like it doesn't typically matter, but I guess in retrospect it mattered. Like, I was a white therapist, and she wasn't warm, and to me, like, warmth really, really matters or mattered. When I had a really strong fawn response, but also just like it didn't feel inviting. It just felt super clinical and sterile, which wasn't my vibe. And in retrospect too, in psychoanalyzing myself, I just didn't feel safe to open up. And I thought, like, she's not really emoting. How can she read me? Or like, it just felt so removed from my experience that I thought, well, I can't really accomplish much here. So that was hard for me because I thought, man, now I'm even more lonely. Like, not even a therapist can fix me. Or like, maybe I could try again, but like, she opened a lot up and she wasn't able to help me. Like, I really don't want to get hurt again and do this again. So I didn't. That was hard. And then it wasn't until maybe somewhere 6 to 8 years later. And honestly, like, I went through really deep depression. And then during the time where I saw that first therapist, I mean, that depression lasted like 7 years. So I tried another therapist later when I was in grad school. And this woman was older, and she felt really out of touch too. And I could tell that I triggered her. which, like, yes, therapists are human, but they should also be professional, right? So I think if you're a therapist listening, just as best you can, seek supervision or consultation and do your best to not be sterile and flat. And try your best to be warm wherever your clients allow you to be warm, because some clients don't want you to, right? Or it's triggering for them for you to be warm. But it's a delicate balance. And then, yeah, so back to the second therapist. She, right, I could tell that I really triggered her. And, like, I'd ask her questions about things that we were learning in school, and she couldn't answer them because she didn't have the knowledge or training, which disappointed me. But also, again, I could tell that it really triggered her, which, again, shouldn't have been happening. And she was very directive, which is okay, but she wasn't open to my feedback. As far as I knew, in social work school, therapists were supposed to be collaborative, right? But she wasn't. And she's like, this is what we're doing. We're doing this meditation. I need you to breathe or read it out louder. And it's just like her tone too. And I did wonder if she was racist. Anyway. So I stopped that because it was causing more harm than good. And I think too, I kid you not, that was at the tail end of my depression. And then my depressive experience, because it wasn't my depression, it was just depression. Anyway, wording matters. And she kind of told me, like, just stop being depressed, or just feel better, or think your way out of it, which just doesn't work, especially not with complex trauma, enmeshment, addiction, personality disorders. Like, there's just so much that I was contending with my family of origin. It simply didn't work. Then I tried art therapy for a little bit, and I enjoyed the art component of things. And I needed to be in my limbic brain, and that was helpful. And creating was an experience, and it was awesome. But, and you can see my attachment style at the time, like, peeking out, like, just like criticism after criticism. But really, like, I needed a ton of safety, and I needed to go slow. But this therapist, like, she really pushed me a lot. And she challenged me too much. And I just really wasn't in that space, you know? And I was in an abusive relationship. And she asked me, which, if you're a therapist, man, it's just, it's a delicate question. What did he say? What did he do? Well, what did he do that's abusive? And it's like, do you need to know? Here's the thing. One, it was really hard for me to articulate what was said to me and what actually was abusive. 2, I blocked it out. 3, I was really dissociated. And then I was also struggling to survive. And then I guess really what was happening is my nervous system was becoming really flooded. And I was completely in my limbic system whenever that abuse was happening. So no, I don't remember what he said. I just remember that I was being gaslit and experiencing narcissistic abuse. And then I was just struggling to keep afloat with whatever dynamics were going on and whatever questions were thrown my way that I don't remember what he said, you know? And then, like, really what I've come to learn from that experience of observing myself, and then consequently in working with a bunch of clients after and supervising a ton of cases after, is that the symptoms are there. Do you need to know the details to work with trauma? Most often, no. You just need to know the symptoms are there, the traumas are there, and then pretty much take the client at their word, right? Of like, hey, here's what's happening. And then the symptoms are just going to be there. The affect, the trauma responses, the stress responses, the relational patterns, the way that they relate to you. All these things are going to be there. So you don't need the details per se to work with affect regulation or co-regulation, right? But my family of origin really gaslit me too, or would tell me that I'm too much or that I exaggerated or whatever. So, like, I had my husband saying those things to me, and then I would try to, like, reach for support with my family, and they would say that I was exaggerating too much and gaslit me. And then my therapist did the same thing. So that was not fun or awesome. Right? Okay. So then I did end up leaving at some point because just, again, it was too harsh for my nervous system and it wasn't trauma informed. Which is unfortunate because every single one of these said that they worked with trauma. Okay. But not everything is accurate in marketing, I guess. I don't know. Where people think they know, but they don't know. But see, I think in retrospect too, like, they were really dissociated from their experiences, and like, I think there wasn't enough training back then, and they were both older therapists, and I get it, they were trained differently, but it caused a lot of harm. Then I had another therapist, also older. This one was a male, and this was a couples therapist, and we had a few sessions, probably like 6 maybe. And I told him, hey, I think I'm in an abusive relationship. And I would say it in the sessions and things like that. But I got the same question. What do you mean? I'm like, I don't know, bro. I'm being gaslit. And just more questions that didn't make sense. And then, like, okay. So he told me, I think you might have ADHD. And so that made sense because I would struggle to complete tasks. And my husband's main complaint was that I would not complete tasks, which he took personally and he took as abandonment. I get it. Makes sense. Also doesn't justify the abuse. And so then the therapist was just like, well, why don't you just finish cleaning? And that's sad. And that doesn't make sense. And that's not solid advice. And just as much as I tried, I couldn't get him to see my perspective, even though it's not my job as a client for like my therapist to see my perspective. But I felt really unheard, and it just wasn't helpful. And again, it was causing more harm than good. So do you see, like, the victim was being blamed in that situation, for one? 2, dang, do you see that I just went through 4 different therapists that I talked about that consistently invalidated me? And, like, objectively speaking, talking to peers and professors and whatever, like any other people that had clinical knowledge, like, it legit happened. But also my point of attraction was rough, you know? Like, can you tell that I was really into trauma? And it just, these are the experiences I was attracting, right? A lot of invalidation. So, okay. I was like, all right, I'm desperately in need for help, and let me take a break and then I'll come back. So then I did. Probably took like a month's break, like maybe. And then I found another therapist, and then I was with her for maybe 3 years. And she was excellent, and she did EMDR with me. She also asked me what I don't know why they asked this question. What do you mean he's abusive? What does he say to you? Again, doesn't matter. No. But I was able to advocate for myself by that time. And I was really tired of being asked that question. I was like, listen, I'm not sure. I just know how I feel. Can we just go with that? So we did. And that was fine. And I think I said she did EMDR. She also happened to be a Reiki master, so that was pretty awesome. And I don't know. She was really quiet and introverted, but she gave me what I needed. She seemed reflective, and I could tell at times that I would annoy her. It's like, yeah, I have a lot of thought spirals, and yes, there's a lot of trauma to think about, and yes, it is repetitive. And yes, I appreciate you holding space for me and my grief at the same time, you know. She's Pessy famous now, so that's exciting. I've been thinking about reaching out to her. I haven't. Anyway, then I don't know what happened. I think I was in a good place. So then I was like, okay, cool. Well, I'll touch base with you again if I need, and then if not, cool. But yeah, so like another year or 2 went by, and then I got another therapist, and This one was cool too, but then the boundaries started shifting, and I started noticing the therapist over identifying with me. And like that happens, I guess. It also doesn't help that I have really high ethics and stuff. So, yeah. But that got tricky. And then I felt like I had to caretake my therapist. And I was like, this isn't working. And then I did end up having to leave at some point. I want to say that's around the time that COVID happened. Maybe it was right before, but that really got in the way. It was hard to respect my therapist at that point. And then also, like, I was reaching the therapist's edge of what they knew. So it served its purpose, and I'm grateful for that. The next therapist that I had was probably another couple years after that. And I was really wanting to focus specifically on, like, I'd done enough therapy and work on myself and meditations and all these other things. I was doing a lot of things outside of therapy. Like, I was eating well, balanced meals, hydrating enough, sleeping enough, getting up early, lifting weights, going to do yoga, and then dancing. And I was getting a lot of somatic release, and then I had a solid set of friends, which was nice. A lot of wins in my life, right? So I got to the point where I wanted to work on narcissistic abuse survival. So I did look into that, and I can't remember. It's like I was reading one book, and then that book led me to another book, which also led me to another book. And then, the directory is called Will I Ever Be Good Enough? I don't remember if that's the name of the book. It's been a while. But yeah, willieverbegoodenough.com. And that's specifically for daughters of narcissistic mothers. And so I did need to process that. And I lasted with this therapist for about a year before I moved away. And she was excellent. I really respected her. I think she was very professional, and she was still warm though, but I think her boundaries were they're a bit rigid for me, which is hard as a Latina, and yeah, but it was still doable and manageable. I think when I needed warmth, I was able to ask her for it, and then she'd provide it, and we'd be okay. Just because warmth does help me feel safe, you know? I don't know. And then I felt really respected by her. And she would tell me that I was smart and that I knew what I was doing. She's like, and stuff like that. But it didn't feel patronizing. It was like, yeah, you know this. And it was a vote of confidence. So then that instilled confidence in myself over time, for which I'm grateful. Then that brings us to my current therapist, who I sought out because I was wanting support with a lot of these really intricate pieces of myself and my upbringing that take a specialist, honestly. But yeah, so I have a therapist right now who specializes in complex trauma and addictions and does EMDR. And she's told me things like a lot of positive messages basically about myself. I want to share them, and I was planning on sharing them, and I pulled up this little sheet where I wrote some quotes that she said, but they feel too personal. And not like it'd be oversharing, but just like, nah, these are little gifts that I want to keep for myself. But suffice it to say that I feel really seen with her, and she's able to go with me to like we can keep it really cognitive if I need to, and then if I ask her for her thoughts and input, she'll give them to me. Or I'll say things like, help me, what do you see that I'm not seeing? Or like we'll talk back and forth and say like, okay, I see this perspective, I hear your perspective, but I feel like there's more. Can you help me find it? So I can really articulate my needs in that way. Or like, I mean, I'm an EMDR consultant in training as well. So sometimes like we'll be talking or something and then I'll be tapping and doing EMDR on myself, which helps. Today we were talking and then she was essentially saying things that were cognitive interweaves that I needed to hear, that my inner child needed to hear. So I did some resourcing around that while I was with her, knowing that like if it fell apart that she'd have me. But also I've done a ton of regulation work where I can handle doing that, right? And activating myself essentially. And what are some other things that I do with her that she does with me? Yeah, like if I need EMDR, she'll do that. Or if I need a second session, she's gracious enough to do her best to squeeze me in. That's really helpful. Or like if my inner child needs to hear certain things, I'll say, can you say? And then I'll say the words. And then she'll say the words just like I asked, which is helpful because like sometimes your inner child needs to hear specific things. Can you tell me I'm lovable? Can you tell me I'm capable? Can you tell me everything's going to be okay? Those kinds of things, right? That's what a secure attachment figure does. But yeah. And then there's the concept of there's different therapists for different seasons or different reasons, just like people. So there's that concept too, right? I think that best practice is to, if you have a therapist and if you are going to have a last session with them, to let them know, hey, I don't want to see you anymore, or I'd like to stop therapy, or I'm going to switch to another therapist or something like that. Because the reality is, wherever we go, we recreate the same dynamics in our relationships until we work through and evolve and heal through them. And there's times where they can give you feedback that you can't see, or maybe you are recreating patterns of avoidance where you avoid conflict or you avoid goodbyes and things like that. And if that's the case, that's clinically relevant, because if you don't work on it, right? I don't think it'll evolve per se. But also, if it's such a persistent pattern, what's causing that, right? And they can give you like diagnoses and future recommendations and different things like that they necessarily wouldn't be able to if you didn't have a closing session. But yeah, the connection is what matters most. Even with interns or younger therapists or anything like that, the connection is imperative. I think in the research it's been shown that 80% or so of the client's outcomes in psychotherapy have been attributed to the connection itself, regardless of whatever modality the therapist uses, which is truly fascinating because we just are such connected people, period. Then with social media come a lot of negatives, and some of the positives are that it has increased awareness of mental health challenges and mental health standards and mental health terms, and so it's creating a lot of educated consumers. I mean, here you are in a form of social media, right? Listening to me talk about mental health. So yeah, I think asking questions. What are some questions you could ask a potential therapist? I think it's like, tell me a little bit about yourself. What are some of the modalities that you do? How often would you be able to see me? What are your thoughts on whatever? You know what I mean? Some therapists, like if you ask them, what are your thoughts on politics, they'll answer. And then you'll find out if you're aligned or not. Some therapists won't, because historically our professional ethics tell us not to. So either answer is valid. I think you'll be able to discern what works for you or not, right? I think if you're a special population, like someone who's queer or a person of color or came from poverty or enmeshed families or narcissistic families or addictive families or anything like that, I think it's important to really discern things, because I do find that as a therapist, it is important to know as much as you can about as much as you can. And if you don't, you're going to miss a lot of things. So it's like, while no one's perfect, it is important to ask a bunch of different questions to the best of your ability. Like random questions like, what do you know about the intersection of ADHD and hypersexuality? You know? Or something like that. Like really niche questions about things that you might be working through. Yeah. Pretty much. Do your best to be honest and advocate. I think that good therapists want your feedback and want to hear you. So then, as best you can, just communicate with them. Hey, do you think we could do a little bit more of whatever it is that you're enjoying in sessions? You know, the part where we talk about solutions all the time isn't working for me. Would you mind holding a bit more space for me? Can we have more quiet while I'm processing my emotions? You know, like feedback like that is totally doable. Those are some phrases you can go back and use if you like. Or if you don't know it, you just be like, hey, can we talk about something? Like, this isn't like, there's something that feels really awkward for me, but like I'm having trouble articulating it. Could you help me figure it out? And then we can figure out how to like work on that together. Even if you stumble, right? As they say, even if your voice shakes, you're still self-advocating, and then the skills that you're practicing in therapy over time will become generalizable, so you could use them in your day-to-day life as well. That's really the aim of therapy. And I think it's also important to know that from the moment that you begin therapy, it's assumed, implied, ideal for you to see the therapist for a certain amount of time. It's not meant to be a lifelong thing per se, at least not in most cases. And so, yeah, a solid therapist will help work toward independence with you. At the same time, a lot of trauma work, if you're really getting into the weeds, like it can take 3 to 5 years, especially if you're treating complex trauma, to get in there. And then if you're treating addiction, potentially even more on top of that. And then just compile the differences, right? Like if there's neurodiversity, or if there's narcissism in the family system, or different things like that. So yeah, because I think especially the more complex trauma you have and the more attachment wounds you have, the more tricky it can become to trust people. So it takes a while, you know? And then I invite you also to discern what your trust patterns are. There are consequences for just really trusting people. There are consequences for taking too long to trust people, right? And there are consequences for really tuning into yourself and discerning who and what to trust with what information. So everything in between also exists. Not sure if I'm actually going to publish this episode. Feels dry, but if I do, thanks for listening. And I will see you next time. Au revoir.